presentation. We will, as I said, be talking about the uses of cord tissue, and Professor Carola Niesler and I will be presenting this presentation. The presentation was compiled by Dornay Jeffries, a scientist in our Net Cells division. So over to you, Carola.
Great. Good evening, everyone. Thank you, Yvonne, for the introduction. So I'm going to turn my video off as I get going, just to save some bandwidth and to ensure that there's no breakup in the sound. I hope everybody can hear me clearly. Right, so perinatal cells include cells in the umbilical cord, blood, and vessels, the Wharton's jelly matrix of the umbilical cord, the amniotic membrane and fluid, as well as the placenta. And while perinatal stem cells are classified as adult stem cells, they do demonstrate some markers and characteristics of embryonic stem cells, such as an increased proliferative rate, for instance. And this suggests that they may potentially be more naive or be a more naive form of adult stem cells. Perinatal stem cells from the cord blood, as shown on the left-hand side of the slide, are so-called hematopoietic stem cells, while those from umbilical cord tissue, which is shown then to the right of the cord blood box, are mesenchymal stem cells. Hematopoietic stem cells are multipotent and give rise to blood cells of myeloid and lymphoid lineages, as you can see in the image on the right. So they can self-renew, they can differentiate into red blood cells, the different types of white blood cells, thrombocytes, and they can also be mobilized from the bone marrow to the blood and vice versa. Mesenchymal stem cells are also multipotent, and they differentiate into a variety of cell types, including, for instance, the chondrocyte, which is your cartilage cell, osteoblast, which is your bone cell, your connective tissue supportive fibroblast, adipocytes, which are your fat cells, and muscle cells, and also epithelial and some supporting neural cells such as glial cells. So it's the umbilical cord tissue itself that contains the naive mesenchymal stem cells when we're looking at the tissue itself of the cord. Next slide, please. So the human umbilical cord plays a really important role in the development of the fetus because it supplies the oxygen and the nutrient-rich blood to support fetal growth. It has a unique anatomic architecture, and that's shown in the image on the right. And this allows for communication between the mother and the fetus through the fetal-placentary membrane and through hormones and cytokine interactions. So structurally, the cord contains two arteries, as shown in the image, and one vein. And these are both embedded within a specific mucous connective tissue, which is referred to as the Wharton's jelly. And surrounding the umbilical cord vessels are the amniotic membrane and the perivascular region. So during embryonic development, hematopoiesis takes place, which is when the body manufactures blood cells. And during this process, early hematopoietic and mesenchymal stem cell colonies start to migrate from the newly formed umbilical cord, and they move towards the placenta. And during this migration, some of the mesenchymal stem cells become sort of stuck or trapped in the Wharton's jelly and remain there for the duration of the gestational period. So these jelly-trapped mesenchymal stem cells generate sufficient microenvironmental components and factors, such as cytokines and stromal factors, which ensure the maintenance of this population and preserve their stem cell nature and their function. So it's these mesenchymal stem cells in the human umbilical cord that represents a key feature of the regenerative property that is found to be present within the cord tissue. Next slide, please. So let's look at some of the properties of mesenchymal stem cells. And we've already mentioned that the fact that they're multipotent. And what that basically means is that mesenchymal stem cells can differentiate into a range of different cell types or tissues found within the germ layer from which they come. So that would be the mesoderm. And the mesenchymal stem cells can then, of course, differentiate into those different tissue types or cell types. So besides cord, as a place where you can find these stem cells. You can also find mesenchymal stem cells in the bone marrow, in mobilized peripheral blood, in cord blood, placental tissue, adipose tissue, dental pulp, and even cardiac tissue has a very small population of mesenchymal stem cells. Now, in order for a stem cell to be considered a mesenchymal stem cell, it needs to comply with the criteria of the International Society for Cellular Therapy, or ISCT. And these criteria include, firstly, the very basic characteristic that mesenchymal stem cells adhere to cell culture plastics. So when you culture them in an in vitro environment, they should be adherent, not adherent. They also express markers such as CD73, CD90, and CD105, and this can be analyzed using, for instance, flow cytometry or fluorescence microscopy. They also need to lack the expression, so they should not express certain hematopoietic and endothelial markers. So there's the examples of these should be your HLA-DR, so your human leukocyte differentiation antigen class 2, which they need to be negative for, CD11b, CD14, CD31, 34, and 45. And then finally, when you culture these cells in an in vitro environment, in addition to the fact that they're adherent, they then should be able to be coaxed into at least 3 different lineages. So as a researcher or a clinician, to prove this, you'd need to make sure they can differentiate, for instance, into bone, cartilage, fat, or muscle. So you choose 3 of those and prove that. And all of those together give you sufficient evidence that what you have in your group of cells includes mesenchymal stem cells. So currently, one of the most well-known characteristics of umbilical cord mesenchymal stem cells when it comes to clinical use is their immunosuppressive property. So mesenchymal stem cells are weakly immunogenic, and that's due to the fact that they lack the HLA-DR and also have a very low expression of the major histocompatibility class 1 molecule. In addition, mesenchymal stem cells lack CD80 and CD86, and these are 2 molecules that are co-stimulatory and induce T cell activation and survival. So the lack of these molecules suggests that mesenchymal stem cells do not elicit acute rejection and are therefore potentially suitable for allogeneic cell-based therapy. One example of how this immunosuppressive effect is mediated is through the factors prostaglandin E2, galectin-1, and HLA-G5. So these are secreted by mesenchymal stem cells and are known to serve as effective factors of immunosuppression. Next slide, please. So the most appreciable advantage of using umbilical cord mesenchymal stem cells is that the collection procedure itself is actually relatively non-invasive and therefore ethically acceptable for potential autologous or allogeneic use. The risk of teratoma or cancers due to transplantation of the stem cells and their ability to become cells that they're not meant to is actually incredibly low. Based on the many trials that have been undertaken, and they have low immunogenicity, they have the multipotent nature, and they have a good immunosuppressive ability, and all of these are then really positive aspects of these particular mesenchymal stem cells. So autologous umbilical cord mesenchymal stem cells could be, for instance, gene therapy candidates in the treatment of inherited diseases. With the advances in gene therapy these days, this has become a real possibility. They could also be used regeneratively or as anti-inflammatory mediators in the context of, for instance, neonatal injury, such as, for instance, cerebral palsy or hypoxic brain damage. On the other hand, the sort of more off-the-shelf approach, your allogeneic umbilical cord mesenchymal stem cell, could be expanded and then cryopreserved in a cell bank. And that could then be used for patients in the future when required. So with these aforementioned properties and advantages, umbilical cord mesenchymal stem cells are of huge therapeutic interest because they represent a population of cells with the potential to treat a wide range of acute and degenerative diseases. So I'll now pass over to Yvonne, who will take you through a couple of trials. Thanks, Yvonne.
Thank you very much, Carola. And so now we move on to discussing the actual clinical application of these mesenchymal stem cells. And the first half of my part of the presentation, I'll be discussing the use of mesenchymal cells in disc degeneration. So an example of degenerative disease in which mesenchymal stem cells can be used as a therapy is your chronic discogenic low back pain. Chronic low back pain is one of the biggest medical and social problems in the world today. And discogenic low back pain originating from intervertebral disc degeneration as a result of traumatic events, as well as deterioration due to age, is considered one of the major causes of low back pain. So just to go through some clinically relevant anatomy, the intervertebral disc is the principal joint between two vertebrae. And each intervertebral disc is composed of the nucleus pulposus, a gelatinous inner part, the annulus fibrosus, an outer ring of fibrous tissue that encloses the nucleus pulposus, and two end plates of hyaline cartilage. The nucleus pulposus is devoid of nerves. However, the outer third of the annulus contains nerve fibers. One type of discogenic disorder is called an internal disc disruption, which occurs when the disc tears or cracks, allowing the nucleus pulposus to meet the annulus fibrosus. When this happens, a chemical called proteoglycan may be released from the nucleus pulposus. Proteoglycans may irritate the annular nerves, causing an inflammatory response and pain. So current treatment options are really limited to symptomatic treatment using analgesics, physiotherapy, and minimal invasive surgical treatment. But none of these methods really address the underlying problem. So disc generation commonly involves changes in the disc morphology and the composition of the extracellular matrix, as well as loss of disc cells. Therefore, a potential therapeutic strategy would be the augmentation of disc cell population to restore normal biologic function and matrix insufficiency. And the source of such cells with the regenerative potential could be mesenchymal stem cells. Now, there have been a number of clinical trials which made use of mesenchymal stem cells to treat intervertebral disc degeneration. A study performed in 2005 demonstrated that mesenchymal stem cells transplanted to degenerative discs in a rabbit model proliferated and differentiated into cells expressing some of the major phenotypic characteristics of the nucleus pulposus cells, suggesting that these mesenchymal cells may have undergone site-dependent differentiation. And then in 2010, another a trial was carried out with studies in which mesenchymal stem cell transplantation restored disc height and function and improved symptoms. In 2011, a trial reported a pilot study in which 10 patients with discogenic back pain underwent injection of autologous expanded mesenchymal stem cells into the nucleus and showed rapid improvement in pain and disability. Both animal and clinical studies indicate mesenchymal stem cell therapy is promising treatment for disc degeneration. Now, this study that was conducted in 2014 makes use of human umbilical cord mesenchymal stem cell transplantation in 2 patients with chronic discogenic low back pain to test its feasibility and safety and obtain the early indication of its therapeutic value. The first case was a patient, a 45-year-old woman with a history of low back pain for 2 years, but without low leg pain. The physical examination revealed a stiff lumbar spine with limited range of flexion, extension, and lateral bending. There was tenderness and percussion pain over the L4-5 lumbar spine. Her lumbar MRI showed L3-4, L4-5, and LS1 disc degeneration without disc herniation. The degenerated discs appear darker in MRI as a result of less water content. The patient underwent a provocative discography at the lower 3 lumbar discs. Lumbar discography was recommended to identify the pain-generating disc. The results of this discography showed L4-5 disc grade 5 disruption with pain reproduction, which indicated the L4-5 disc as the source of pain. The patient then underwent a transplantation of human umbilical cord mesenchymal stem cells at L4-5 disc through the discographic needle immediately following discography. So basically they injected stem cells into the disc. This procedure was successfully performed and the patient reported obvious back pain relief and lumbar function improvement. The alleviation of pain and improvement in physical function was assessed by the change in the degree of pain with a self-assessment of pain by an 11-point visual analog score, the VAS score, and the Os-Westry Disability Index. The VAS score was 7 before mesenchymal stem cell transplantation and was 2, 1, and 1 at 6, 12, and 24 months, respectively. The ODI was 46 before the transplant and was 10, 5, and 5 at 6, 12, and 24 months, respectively, after transplantation. At 2 years after the procedure, MRI signal intensity in the L4-5 disc was higher when compared with that before transplant, and which indicated higher water content in the nucleus pulposus at L4-5. The second case was a 38-year-old man with a history of low back pain for 4 years. The MRI scan showed L3-4 disc degeneration, and the provocative discography showed L3-4 disc grade 5 disruption and was concluded to be the source of pain. Hematopoietic, human umbilical cord blood mesenchymal stem cells were transplanted in the L3-4 disc space. After transplant, there was a significant improvement in his VAS and ODI scores as well. Now, although the sample size of this study is small, the present study has shown that mesenchymal stem cell transplantation is both feasible and safe with no side effects. The underlying mechanisms of the treatment remain unclear. However, data from animal studies have shown changes in cytokine expression following growth factor injection, indicating a possible mechanism for pain relief. A recent study indicated that mesenchymal stem cells could also be induced to differentiate into nucleus pulposus-like cells by co-culturing with nucleus pulposus cells. These studies suggested that the mesenchymal cells could differentiate into the nucleus pulposus-like cells after being grafted into the disc, and therefore it restores the extracellular matrix. Mesenchymal stem cells also help relieve pain through reducing inflammation, as Carola mentioned earlier. So this present study indicates that transplantation is a favorable alternative method for the treatment of chronic discogenic low back pain. Further studies obviously need to be conducted with larger sample size and followed up over a longer period of time. Now, as mesenchymal stem cells were shown to reduce inflammation in this study, they have also been shown to have the same effect in other diseases, including COVID-19. So now I will just share with you some studies that have been done in using mesenchymal stem cells for COVID-19. As we all know, the coronavirus pandemic has taken our world by storm. This pneumonia-like disease caused by the SARS-CoV-2 virus results in severe immune response causing COVID-19. The general mechanism of action of this virus is that the SARS-CoV-2 enters the respiratory tract. The S protein on the surface of the virus binds to secretory cells in the nasal epithelium and membrane protein ACE2, which is highly expressed in bronchoalveolar type 2 cells. Subsequently, the virus enters the host cell through phagocytosis, increasing the concentration of pro-inflammatory angiotensin II. A high concentration of angiotensin II in the lung interstitium promotes apoptosis, release of pro-inflammatory cytokines, and triggers an inflammatory response, leading then to the cytokine storm and the pneumonia in COVID-19 patients and to acute respiratory distress syndrome in severe cases. Recent studies indicate that the development of acute respiratory distress syndrome in severe cases is accompanied by a massive release of pro-inflammatory cytokines, such as your interferons and your interleukins, as well as other chemokines. This cytokine storm then triggers a substantial immune response to the affected organs, leading to vascular leakage and edema, tissue inflammation and damage, multi-organ failure, and severe morbidity. So therefore, there is really an urgent need for novel therapies that can attenuate this excessive inflammatory response associated with the immunopathological cytokine storm and immunothrombosis that can accelerate the recovery to functional lung tissue. So as mesenchymal stem cells are known to be immune privileged, safe, and able to have immunomodulatory abilities, they have been tested in limited clinical trials to treat COVID-19 patients with pneumonia. For the purposes of time, I will only highlight a few mechanisms from this diagram relating to immune responses of mesenchymal stem cells. So now mesenchymal stem cells promote epithelial and endothelial repair, alveolar fluid clearance, and bacterial clearance, and exert anti-inflammatory and anti-apoptotic effects. Mesenchymal stem cells enhance the differentiation of your macrophages to macro M2 phenotype, produce anti-inflammatory cytokines, and inhibit the pro-inflammatory factors. Mesenchymal stem cells may promote the regeneration of type 2 alveolar epithelial cells by producing certain growth factors like your keratinocyte growth factor, vascular endothelial growth factor, and your hepatocyte growth factor. They also then prevent the apoptosis of endothelial cells and contribute to the repair of alveolar epithelial barrier. Studies on respiratory syndrome patients have shown strong correlation between the elevated serum levels of pro-inflammatory cytokines such as interleukin-6 and CRP and disease severity. Therefore, in addition to targeted antiviral therapies, which we are obviously investigating, there is a lot of attention towards immunomodulatory interventions to mitigate disease progression and obviously severity in critically ill patients. So a lot of the trials are using mesenchymal stem cells from a variety of sources to treat COVID-19 patients. This study that I will present now from October 2020 looks at umbilical cord mesenchymal stem cells to be administered intravenously in patients with ARDS. So the objective of the study was really to establish the safety and explore efficacy of allogeneic, in other words, mesenchymal stem cells from another donor in hospitalized patients with ARDS secondary to COVID-19. The study was double-blinded, meaning that neither the patient, obviously, nor the assessing physician was aware of treatment assignment. So 24 subjects were hospitalized with COVID-19 and randomized to either the mesenchymal treatment group or the control group. So apologies, I said 24 subjects. I made a mistake earlier. It was actually 28 subjects were enrolled, but 4 were rejected, which then left us with a number of 24. And these were randomized equally into 12 receiving mesenchymal stem cells and 12 in the control group. The 12 subjects that were allocated to the mesenchymal group were given 2 intravenous infusions of 100 million umbilical cord mesenchymal stem cells in a 15 ml vehicle solution containing human serum albumin and heparin. And they were given these injections at day 0 and day 3. These cells were derived from the subepithelial lining of the umbilical cord. The other 12 subjects were allocated to the control group, were given 2 infusions of just the 50 ml vehicle solution at day 0 and 3. Now, this table shows the demographics, baseline characteristics, and concomitant treatments of the enrolled subjects. Looking at the ARDS severity stratum, 3 subjects in each group were stratified as mild to moderate, and 9 subjects were stratified moderate to severe. There was no significant difference in the concomitant treatments between the groups. The statistical analysis performed here where the Fisher extract test and the Wilcoxon 2 sample tests for categorical and continuous variables. The researchers reported on serious adverse events found between the 2 groups. 2 serious adverse events were observed in the umbilical cord group and 16 severe adverse events in the control group. So less serious adverse events, and this is not necessarily due to the treatment, it was more serious adverse events from the disease. The researchers looked at 3 aspects when concluding on the results of the study. And those were survival after transplantation, severe adverse event-free survival, and time to recovery. After 31 days after the first infusion, patient survival was significantly improved in the umbilical cord mesenchymal group as opposed to the control group. The severe adverse event survival was also significantly improved in the mesenchymal stem cell group as opposed to the control group. And again, the time to recovery was much faster in the mesenchymal stem cell group as opposed to the control group. So all in all, those results were very much were very positive indeed. Then when we looked at inflammatory cytokines in the comparison between the groups at day 6, the inflammatory cytokine concentrations showed markedly and statistically significant decreases from day 0 and 6 in the group treated with the mesenchymal stem cells. So the overall signature of the response of the mesenchymal treatment in the group is characterized by a reduction in the levels of key inflammatory molecules involved in the COVID-19 cytokine storm, which is exactly the kind of results that we would be looking for in this kind of trial. So in conclusion, the observations made in this study could be of assistance for future studies in the field of COVID-19, ARDS, your hyperinflammatory states, and overreactive immune responses and autoimmunity. In addition, the preferential targeting of lung tissue after intravenous infusion could make umbilical cord mesenchymal stem cells particularly appealing for ARDS secondary to trauma or microbial infection. The results of this trial indicate that your umbilical cord blood mesenchymal stem cells infusions in COVID-19 with ARDS are safe. Moreover, mesenchymal stem cell treatment was associated with significant reduction in your severe adverse events, mortality, and time to recovery compared to the control group. So, in summation, it would seem that mesenchymal stem cells from umbilical cord tissue can have a therapeutic effect in a range of diseases, spanning from back pain to ARDS. This is all thanks to its multipotency, ability to reduce inflammation, and its immunosuppressive ability. Many studies have shown that umbilical cord mesenchymal stem cell transplantation as treatment is safe and effective. This therefore allows the opportunity for more studies to be performed on the use of umbilical cord mesenchymal stem cells for the treatment of a range of diseases. And we certainly will see in the future clinical applications using these stem cells. So thank you, everyone. That is the end of our presentation. Please feel free to ask any questions. You can write them in the chat box. Ali, do we have any questions?
Hi, Yvonne. No questions yet, but anyone is more than welcome to put their hand up and can be an open conversation, or you can pop it in the chat box.
We'll give people another minute or so. There is a question, is the treatment available in South Africa? Not really at the moment. As I've said, the treatment that we have described is, they're all clinical trials, they're all still very experimental. We certainly would be very prepared to assist any doctors, physicians who would like to try such trials in South Africa. Our laboratory would be very happy to process the stem cells. There was actually interest from Mill Park Hospital to run a trial using mesenchymal stem cells for patients with COVID. The Department of Health are happy to give permission. However, they just want animal studies first. So we are now, they have to look at some animal studies first, and then we will hopefully, perhaps next year, go on to human studies. So at the moment, we do not provide umbilical cord stem cells to anyone. You would really have to get a participating physician who would be willing to do that and talk to us, and then we can certainly work with them.
Yvonne, I just answered, there was a question in the Q&A, so I just I popped an answer in there. If whoever put that in there, they can just have a look at the answer there regarding organs from mesenchymal stem cells. I think there's another question there at the moment.
Sorry, I don't see that question.
Can mesenchymal stem cells from umbilical cord be used for any family member, notably for elder family members with severe back pain? Could be used for any. So the answer to that would be that so mesenchymal stem cells can be used allogeneically as well as autologously. So if within your family, in the South African context, you have banked cord tissue stem cells, then certainly that would be an option. Alternatively, approaching your physician and finding out whether there are any ways in which they can assist, whether there are any donated tissues that could be utilized for an allogeneic purpose, that would be something. And then you could approach NextBio in that regard in terms of processing. That would be my advice. I don't know, Yvonne, if you have anything to add.
Yes, no, I just wanted to say, so autologous means using your cells for yourself. Allogeneic means using the cells for somebody else. And they don't necessarily have to be related to you. As we've shown, these mesenchymal stem cells don't cause a reaction when they are transplanted into someone else. They're not like the hematopoietic stem cells of umbilical cord blood, where we have to find an exact match.
And I think the question in the Q&A, I think, was in the chat as well. We just have a look. Umbilical cord graft for MMC. So I think that you'd answered already, Yvonne.
Yes.
Okay, great. So let's have a look.
Right, so I think that's it. We don't have any further questions, but please feel free. You can always email us if you think of any questions later on, and the recording of this presentation will be available. So thank you everyone for joining us, and I hope you have a great evening. Stay safe, and we will see each other soon. Thank you.
Thank you. Good night.
Good night.
Thank you.